Stem cell usage in the spine is really very limited at this point, but in the right patient, the right product can really help a patient. So things we got to differentiate and generally understand is there's different ways that patients have been offered stem cells. There's autologous stem cells, which are your own body cells, or allograft stem cells, which come from somebody else. Allograft includes placental or amniotic, umbilical cord blood, and also adult donors. You have to understand that none of these are FDA indicated, so they're not approved by the FDA. If they're being used, they're used off-label, or they're in a clinical trial. So be sure to be aware of what situation you're in and understand that they have to be clear about this. The other thing we have to understand is that a lot of these are being offered, but there's not much as far as any type of studies showing the benefit of these products. So the other type of stem cells are the autograft stem cells, and the advantage of the autograft is it's your own body. So the risk of having contamination from somebody else's tissue or any type of reaction to that tissue being a foreign product injected into you is much lower. The two major areas of autologous stem cells are adipose, which is your fat cells, and bone marrow. So adipose has the advantage of having a higher concentration of stem cells, but the disadvantage is that there's no other growth factors along with those stem cells. So another thing you have to understand is that adipose, the process of getting those adipose stem cells is something under investigation by the FDA, and they've warned people that use adipose to do it in a very specific way. And the big thing they watch out for is using an enzyme to break the fat cells. And so again, doctors cannot use this product when using an enzyme at this time due to FDA regulation. But it can be used. I personally prefer bone marrow aspirate, and this for two reasons. Number one, again, a high concentration of stem cells. Number two, there's growth factors in your bone marrow that also stimulate the healing process. So the way it's done is while laying on your face, your back and upper buttocks are cleaned. You can be sedated for this procedure if necessary, but it usually has minimal pain. After placing the needle into the bone, the needle's in place, we can aspirate the bone marrow. And then this bone marrow is transferred to a special device to concentrate the stem cells in that bone marrow. These stem cells are then injected back into the damaged disc, and the procedure is complete. Please note that the product that we use to concentrate the bone marrow is FDA approved specifically for that use.